Good morning, everyone. I'd like to welcome everybody for the Public Presentation Committee meeting, November 19, 2024. Sorry, I apologize, we were a little bit late. This committee meeting will be conducted in person and via conference call in accordance with the MGA Section 199. Chambers will be open to members of the public while continuing to use current telecommuting process in place. To join the Public Presentation Committee via teleconference, dial the number 403-917-1764 and the PIN is 47001 when prompted. We have a agenda in front of us. Any additions or deletions? If not, a motion as presented.
I'll move the agenda as presented.
Motion's on the floor. We'll do a roll call vote. I'll call the question. Councillor Peace?
In favor.
Councillor Bigger?
In favor.
Councillor Eichert?
In favor.
Reeve Link?
In favor.
Myself's in favor. Councillor Kester?
In favor.
Councillor Larson?
In favor.
And that's passed. We will move on to our first appointment, Harry Somm, trustee for Christ the Redeemer Catholic School. Presentation. Please come to the mic and state your name. Yeah, the podium there. Yep. And I believe you have a program that's probably loaded up for you and everything.
Good morning.
Welcome, Harry.
My name is Harry Somm.
Oh, just have to push it once and it'll light up. There you go.
Oh, and it stays on?
Yeah.
Oh, okay. New technology. My name is Harry Somm. I'm the trustee for Christ the Redeemer Catholic Schools. I represent Strathmore and most of West Wheatland. This is our superintendent, Dr. Andrea Haloka. I don't know if you just want to go through the PowerPoint presentation.
Yes, that would be fine. Yeah.
Okay. Do you know how to advance this? Oh, okay. Yep. So you can read our mission, vision, and we also have core purpose as well. We are an evangelizing school division. We work in conjunction with the parish and the family to create a Catholic environment in each of our schools. Catholic learning experience by creating a foundation of faith and knowledge in a warm, caring environment to guide all students to appreciate the goodness of all creation and to meet the challenges of life with hope and confidence. And we offer Catholic education, obviously, English language, French immersion, home education, online learning. We have 3 outreach centers and we provide kindergarten as well. We have 17 schools. We are scattered across 7 communities from the BC border to the Saskatchewan border. We serve over 10,000 students in those communities, and we have tremendously strong academic results in all of our schools. This is generally for all of our schools collectively, for Christ the Redeemer as a whole. These are our academic, our assurance results from the Alberta Education reporting results. And you can see, like across the division, each one of our results is higher than the provincial average. These are our division priorities. Obviously faith first for all of us, our Catholic faith. Academic excellence is always at the top as well, and healthy schools. If you want to jump in anytime.
Yeah, I can see. Hello. I think one of the important parts for you to know about our division is that we do actually invest quite heavily in our academic excellence. So I'll just go back a slide just to demonstrate that, and we've provided some handouts to you as well. When you look at publicly funded school divisions, we would probably be at or near the top provincially. So our graduation rates, our diploma exam achievement, and then all of the survey measures that are asked of parents, teachers, and our students would demonstrate that they have great confidence in what we're providing as far as our education, and that we provide safe and caring environments for students. So I just wanted to highlight that because it is, once our results are publicly released provincially at the end of this month for all school divisions, you would probably see Christ the Redeemer at the top of all of the school divisions across the province.
So yeah, if you have questions at any time, just ask away. I can't read this one, it's too small.
I can speak to that. So, you know, that Harry spoke to our division priorities, but on the right-hand side of this graphic, which is too small, and I apologize for that, it definitely does demonstrate that we have an education plan that really is lived out through these priorities. So the Board of Trustees sets the priorities for our division every year, and they really become quite foundational to what we do. And we're very focused on our results to ensure that we do have success for our students. So although we know that there's quite a narrative provincially about teachers being overloaded, and that we see that there's challenges within classrooms with complexity and so on, that doesn't really affect us in our motivation to continue to provide that strong academic support in a Catholic environment. So the education plan just really reinforces those priorities.
This is just a little bit of a history about, so we have schools in Drumheller that would serve East Wheatland, like the area around Hazard and that, and out in that, you know, part of the county. And then we have two schools in Strathmore. You would probably be, you'd know them better as Samuel Crother, or the former Samuel Crother School. We expanded the school in 2004 and created Holy Cross Collegiate. So we have Sacred Heart Academy, which currently has 309, Holy Cross Collegiate 338. St. Anthony's goes from kindergarten to grade 12 in the one building. Sacred Heart Academy did open in 2001, so next year will be 25 years for us. We started with 125 students from grades 1 to 7, and we added one grade each year for each year following that. Then expanded the school in 2004, like I said earlier, and created Holy Cross Collegiate. These are the results specific to Sacred Heart Academy. If you want to talk more to these.
I think just to highlight here is, you know, you see the Sacred Heart Academy results in sort of that deep red color compared to the province. It is a school that is very, very focused on success academically. And I'd say our schools that serve Strathmore and the surrounding county really do provide a very strong basis of learning. And there's a lot of assurance in the community about what we provide. So again, this is just a snapshot of our strong results that are required measures by the province. I might as well stay up. Going on to our graphic on Holy Cross, which is our 7 to 12 school, you'll see that continuing in most areas. There certainly is one part of Strathmore that is very, very strong is our 3-year high school completion rate. And that is very much above the provincial results. I think it's very close to 100%, just under, which really speaks to the incredible dedication that our teachers have to ensuring that all of our students graduate within 3 years with very minor exceptions. And these are students that would have experienced quite a bit of schooling during the pandemic. So being able to really see that through to seeing those students be successful is, again, quite an accomplishment for those schools.
This is St. Anthony's in Drumheller. It's located on the north side. The original St. Anthony's built or established in 1959. I can't remember the exact year. Oh, new school built in 2012. And it was designed by the architect to fit right into the landscape in behind. And these are, I don't know if you want to.
Sure. Yeah, and again, just the last graphic with our graphs on there to show, again, our assurance data for our Drumheller St. Anthony School. And again, very strong results, especially when it comes to the assurance that the community has in the school. And although it is a K-12 school, it does really cater to an experience where students are known and supported very well with their education all the way from the start of their educational career right to grade 12. And it's very evident in the school. So again, a lot of focus on learning, a lot of focus on supporting students with learning needs, and again, seeing that graduation rate being very strong from the school.
Just before we move on to the next slide, I was just going to let you know that both Sacred Heart Academy and Holy Cross Collegiate just went through renovations, and Holy Cross had an addition. Years in the past, we had modified the gym in Sacred Heart Academy, reduced it in size a little bit to accommodate a band room for Holy Cross Collegiate. We just recently finished an addition to create a new band room for Holy Cross, and then reestablished a full-size gym for Sacred Heart Academy. Questions?
Thank you. Any questions for the presenter?
I just have, like, on funding, you're funded this on the same level as the public school board is funded? You're not?
Exactly the same, yeah.
Thank you.
Go ahead.
Do you track what your students do after grade 12? Like how many of them go on to, whether it's the SATE, NATE type things or college or university? Like what's the percentage?
Yeah,
Like get further education is what I'm looking for.
Yeah, I could provide that as a follow-up to you. We've just received those results. So there is, the government does track for us how many students go on to post-secondary. And there's also an assurance measure within this that does track the perception of preparing students for work as well. Those, as a division, we are extremely high in those areas. These schools would be no exception. So we definitely would see that trend. It says they track it in the province for 6 years to see if those students do achieve going to post-secondary, and we see that they very much do. And that would include any university or polytechnic across the country. Yeah.
That's pretty much what I suspected.
Yes.
I just wanted to hear it from you.
Yeah, no problem.
Any other questions?
I can tell you, the only one I can tell you specifically, my oldest daughter was in the first graduating class, and there was 7 kids that graduated. 1 went on to become a lawyer, 3 went on, I know that they have 2 degrees. 1 went on to college, and 1 became a welder.
Welder probably makes the most money.
That's true.
Reeve Link, did you have any questions?
No, but I appreciate the presentation. Thank you.
Yeah, so I did want to say thank you very much for the presentation. I believe this is the first one I've seen since I've been here 7 years, but it's nice to have an update on the Catholic school. I know my stepson did attend Catholic school in Airdrie for years and years and years, and I know lots of people in Chestermere and stuff that there's quite a few Catholic schools there as well. And it is definitely a good option for people if they are, and it's not just the faith anymore, I understand. You don't have to be Catholic to be in a Catholic school, correct?
No, you never had to be Catholic.
Okay.
We accept everyone.
Okay.
Even like Catholics.
So, yeah, no, great presentation. Nothing further from anyone? Okay, thank you very much for the presentation.
So I guess, thank you from us for just the opportunity for being here. And I guess right now, all I would just like to, reassure, right now, we have no ask. We just wanted to come out and, meet county council, and we may come back sometime in the future, if growth pressures, require it, to ask for funding or land for a school, or, for assistance with site work or something like that. But we would give you lots of notice on that. The only other thing that I did talk to Amber about while trying to set this up was that, and I think I would leave it with her to coordinate with all of you, is that if you did want to see the new church, the new Sacred Heart Parish, and have a tour of the building, by all means, more than welcome to do that.
I've heard it's nice.
We are very proud of it.
It's definitely different than the grocery store.
Well, thank you very much for the invite, and we'll leave that to be set up for later if people want, and maybe even a tour of the school, maybe. I graduate, well, I didn't graduate, but I did go through the older version of that school, so it'd be interesting to see it updated now.
Yeah, that can always be arranged as well.
Yeah. Thank you very much. Any further questions? No? All right, thanks again.
Yeah, thanks again.
Yeah. So we got time for another presentation, or do we want to flip over to the other meeting?
We should flip over to the other meeting. The next one is scheduled
For
for
11:40, yeah.
11:40. And I believe they were coming right from the airport, so they might be just a little bit late. Just
With the fog out there, yeah,
Yeah.
could be, yeah. So we would then recess? Public
and
present-
council may choose to make a motion to accept this presentation as information as well at the meeting.
Motion on the floor from Councillor Larson. Any discussion? I will call the question. Is Reeve Link still online? Okay. Roll call
I'm in
vote.
favor.
Okay. Reeve Link's in favor. Councillor Priest?
In favor.
Councillor Bigger?
In favor.
Ikert?
In favor.
Clausen's in favor. Councillor Kester?
In favor.
And Councillor Larson.
In favor.
And that's carried. Just a question from admin. Should we recess this meeting and continue on the other one? So do we need a motion to recess? Or just? Chair
No,
can-
no motion to recess.
Okay.
And just
So I will recess the Public Presentation Committee, because our next, recess the committee, the whole agenda at this time. And we will move back to the Public Presentation Committee meeting agenda, because I have our 1140s here. Dr. Sultan Nelson and Dr. Alex Cazares of Frontier Diagnostics. Please come forward. Microphone's there, and there'll be a presentation for you, and you can present to us. Thank you. And if I butchered your names, I apologize. I tried my best.
Need the button.
You just have to press the button, it'll turn green, and then it's on. Good. There you go, sir.
See, we should have got that.
So hello, everyone. My name is Alex Koziars. I'm one of the radiologists working with Frontier Diagnostics. With me here today is Dr. Sultan Nelson, who some of you know as the CEO of Frontier Diagnostics. Also part of this project is someone by the name of Ricky Shen. He has been instrumental in developing a CT and MRI center in Ontario. And he's also part of this proposal, as part of this project. Today, I'm very grateful for the opportunity to speak with all of you in terms of our proposal to extend the services of Strathmore Hospital to include a CT scanner. So our proposal starts with this map of Southern Alberta. Alberta Health Services likes to divide Alberta into regions called local geographic areas, or LGAs for short. Some of these regions are large and others are quite small, but the main purpose of these regions is to obtain demographic and health-related information about that specific region in order to make decisions related to healthcare. Our proposal is specific to the Strathmore LGA, which is centered at the Strathmore Township, but also includes a few communities surrounding that town. We can see it here highlighted in yellow. It's a fairly diverse region, including the Siksika Nation highlighted in orange at the southeastern aspect. So, why are we interested in the Strathmore LGA as opposed to other LGAs? Well, for one, Frontier Diagnostics has been successfully operating an imaging center here for almost 5 years. In addition to that, it's serviced a lot of citizens around the Strathmore Township, which includes Wheatland County, as well as many patients from the Siksika Nation. In addition, the area is quite diverse, as I mentioned previously, including Siksika. As we can see here, there's about almost 11% of persons in the Strathmore LGA are categorized as First Nations and Inuit people, which is significantly higher, almost 4 times higher than the Alberta average. But the most significant reason why we chose the Strathmore LGA was largely the health outcomes that we obtained through looking through Alberta's published information. Unfortunately, the Strathmore LGA has significantly higher mortalities related to cancer, cardiovascular disease, as well as traumatic injuries. All these statistics were obtained and are publicly available. It was quite surprising for us to see that, for example, if someone lives in the Strathmore LGA, they're more likely to die approximately 3 years sooner compared to Alberta overall. They're also more likely to live with chronic diseases compared to Alberta overall. And when comparing to other rural areas, these numbers were also higher. So we thought that this was quite surprising, and it's difficult to determine where these conditions come from. There's a lot of research in this area. However, one thing we know that in order to treat them, we first have to diagnose these conditions. And one of the main ways you can diagnose any of these conditions includes a CT scanner. And that is one diagnostic test that is missing within Strathmore Hospital. And this is what brings us to our proposal today to implement a CT scanner at Strathmore Hospital. So where does the CT scanner fit into this care? Well, first of all, it can be ordered by any physician. Typically, it's ordered by a family physician, but can also be ordered by an emergency doctor when someone would present for an emergency. CT scan would help clarify what's the cause of a patient's pain or their presentation, and then they can be either treated or followed up based on those results. Sometimes those results are quite urgent and require urgent surgery. A CT scanner is essentially the, you can say, backbone to the diagnostic process in modern medicine. It's kind of the workhorse. It can scan patients very quickly and has a highly accurate ability to identify a variety type of conditions. In the emergency department, we can diagnose things like stroke, fractures, or urgent intra-abdominal abnormalities. On the non-urgent setting, such as when it's ordered by your family doctor, it can identify conditions like cancer, cardiovascular disease, or lung disease. In short, it can save lives by diagnosing conditions earlier or identifying urgent conditions that require that quick management. So for that reason, it's implemented in almost all hospitals. However, it's not present at Strathmore Hospital. This is a map centered at Strathmore Hospital. We can see here that there are a variety of communities, including Siksika, that will send their patients to Strathmore Hospital as the first step in their care pathway. Routinely, we will see patients that are sent for very urgent conditions that need clarification in the emergency room. Now, what happens if a patient comes and is in urgent or critical condition, meaning they need treatment, otherwise their risk of dying is very high? Well, from an imaging perspective, this becomes a fairly complicated process. Now, if they're not imminently dying and they're okay, they're medically stable, as we say, we can send them to Frontier Diagnostics outpatient clinic for an X-ray or ultrasound. However, if they are in critical condition, an X-ray or ultrasound will simply not be a suitable test. They cannot clarify what is going on with that patient. So what happens in these cases? Well, this is where it becomes a little bit complicated. The patient, if we're very concerned about them, will then have to wait for transportation at Strathmore Hospital and then be driven by an ambulance to the nearest center in Calgary, which takes nearly an hour, and then wait there for a CT scanner. And this is very concerning for these very urgent conditions because time is of the essence. There are several patients who unfortunately have died waiting for that CT scanner. Having that CT scanner at Strathmore Hospital would have helped clarify what the diagnosis was, so treatment could have been initiated much sooner. So in other words, what we're proposing here is nothing out of the ordinary. This is present in other communities such as High River, such as Hinton, but it's not present in Strathmore. So in addition to the more short-term health benefits, there's many other benefits in terms of having improved healthcare within a community. Yes, we can save lives, we can identify conditions earlier, such as cancer, and treat those conditions. But one benefit is it actually creates sort of a medical hub for the Strathmore Township and the Strathmore LGA. So in other words, if there's good diagnostic imaging, that will welcome other doctors to come to these areas because they feel more comfortable treating patients. Nowadays, most family doctors are trained in larger cities where they have several CT scanners. So there's a bit hesitation going to a smaller region where there aren't as many resources. And for that reason, there's not as many family doctors or not nearly as many specialists in communities in the Strathmore LGA compared to larger cities like Calgary. In addition, there's a lot of other ramifications, a lot of positive benefits in terms of having a healthier community. One of the new developments that we've heard of was the de Havilland Field Project, which is projected to have a few thousand additional jobs, and from what we've read, there will be an increase in the population near Strathmore. And given this rapid projected increase in population, having a CT scanner, having a more developed healthcare system within this region would be quite important, as already the hospital is quite strained, and having several thousands more patients that people will have to take care of will only further strain that system. So what is the criteria to create or add a CT scanner? Well, from our understanding, Alberta Health Services has a few criteria. One of the main ones includes how many CTs are projected to be performed within that CT facility. So the Strathmore LGA, the local geographic area, has an estimated population of about 36,000 based on publicly available information. That will then project to about 22 scans per day, which exceeds many other CT facilities such as in High River as well as Hinton. So we fulfill that criteria in terms of this proposal. An additional criteria includes the distance certain patients are to the nearest CT scanner. Since there are several patients or many patients in Siksika who are part of the Strathmore LGA, a lot of those patients are actually more than 100 kilometers away from the nearest CT scanner. Traveling with a patient like that, especially if they have a very urgent condition such as a heart attack or a stroke, will most likely lead to poor outcomes given that wait. So for that reason, a lot of the criteria that Alberta Health Services, AHS, has for CT facilities are met given the circumstances of the Strathmore LGA. Every proposal will need some sort of plan, and Frontier Diagnostics has been working on this plan for several years. With our experience in terms of building a CT scanner in Ontario, we have made several connections with vendors, with these builders who are able to construct such a CT scanner, as well as how to obtain the machines. A lot of these vendors also have created facilities within Alberta, so they have experience there as well. What Frontier Diagnostics proposes is to invest the capital required for building the CT scan room as well as the machine itself, which will be approximately $1.6 million. We also would like to cover the operating costs of a clinic, which includes a lot of the service agreements for the CT scanner, as techs will have to come in and evaluate the machine, make sure everything is running properly, nurses, technologists, and other healthcare related staff. What Frontier Diagnostics would request from Alberta is to provide us with a contract to help read those fees as well as operate the facility. In this way, we project that there will be minimal startup costs for starting this type of venture, as well as reducing costs associated with transferring patients who are in critical condition to Calgary. In this way, there could be long-term as well as short-term cost savings of this proposal. In addition, Frontier Diagnostics has been operating with a high level of efficiency on an outpatient basis, and we can also do this on more of an inpatient basis in the hospital. We've already received a lot of support from several family doctors within Strathmore, and we kindly ask for your support as well, and welcome any sort of questions or comments regarding this proposal. Thank you.
Thank you very much for the presentation. Any questions? Councillor?
Is there room in the hospital right now, or would this be an add-on to the hospital?
Right. So the CT scanners nowadays are much smaller than how they were historically. We have a few physicians working in the hospital, and there should be enough room in the hospital. Should, in the unlikely scenario, there is not enough room for just the CT suite, we would then work with the hospital in terms of seeing if we could add on a building adjacent to the hospital to put the CT scanner in that location.
Go ahead.
So is your model so that there's going to be, if I wanted to, like Mayfair Diagnostics, where I can pay out of my own pocket to get, is that part of your model, or is this going to be, has to be fully government funded?
So this model, what we're proposing is a government-funded proposal. Now, all the patients that would require these CT scans anyways would be getting them in Calgary. So the same billing would ultimately be provided, would be still paid out. However, we're just proposing to have that in Strathmore.
Any other questions? Go ahead.
You mentioned something about attracting family physicians.
Mm-hmm.
There's been I don't know all the physicians, but seems to be a few of them missing year over year.
Mm-hmm.
Do you think this would help our region attract, I was going to say younger family doctors, but people looking to set up a practice in the area? Or?
I definitely think so, just because of how much more diagnostic capability it would provide with these family doctors. Nowadays, family doctors, whenever there's an issue, they will routinely order imaging as part of that appointment. And the fact that a big component of that imaging is absent in Strathmore makes it a less attractive area for family physicians. In addition, I would be one of the radiologists reading scans for this center, and my wife is the family doctor, so we're joined quite closely. So she would also be one of those family doctors, and given her feedback from this proposal as well, it's something that would attract her to a location like this.
So I live in Rocky Ford and I want to scan. They make an appointment for me in Calgary and then I got to wait. I'm thinking if we had one in Strathmore, would it be more timely? Are you hoping to be more timely, or is this like another 6-week wait or something? Or consult by your family physician. I would hope if I was run over by a truck, I'd be a little faster.
So in terms of obtaining a CT scan, you would need a requisition from any sort of physician. It's mostly a family doctor. With the implementation of this CT scanner, there would be lower wait times compared to existing centers, as what happens is with existing centers, patients will continually have referrals for these centers, and that will build up the wait list. With here, we're opening up a new center, which would allow essentially no wait list at the beginning, and in turn, the wait time would be shorter.
Go ahead.
I'm curious if you have talked at all to the Strathmore Hospital Auxiliary Group. I believe they accept donations towards new equipment for the hospital. Would this fall within their realm of being able to help you?
So I think Sultan is quite close with the hospital group, so he can answer that question.
Yeah, so actually we did not look into it. Our main idea was not to burden the community with financials as well. This is purely doctors, all of us coming up with the money to put it in there. But obviously, if the community wants to contribute to it, we are open to that as well. If I may answer your question, I know Alex answered in terms of bringing more doctors. We do have a number of doctors already signing signatures that they would be considering to come to Strathmore area and practice if the full scope of this kind of diagnostic imaging is set up.
Perfect. Go ahead.
And so you have already applied to Alberta Health in order to get a contract for this, or are you wanting letters of support in order to do that, or where are you at in that process?
Yeah, I think we're in the first phase of that process. Make sure there is, obviously this is a community supports the idea as well, and everyone is in agreement. So we can put in all the application, the proposal together. Yeah.
Go ahead.
So just so I'm clear here, you said that this would be physician funded or something. You've got a cost here of 2.6 million and change with your, upstart and the operating costs. Are you looking to us for some money for that, or just a letter of support?
So from the Wheatland County, we're only requesting a letter of support. There's no financial request from your party here.
Is that a yet or?
No,
Okay.
no, we would not be looking for any sort of
Okay,
financial
just so
support here.
It just, the letter of support's a very easy decision. The financial one is a little different. Yeah.
Mm-hmm.
Okay.
Anything further? No, thank you very much for the information. It's always good to have new things brought into the area, and if it's funded by you, even better.
Yeah.
Because we get inundated with asks all the time.
Great. Thank you for your time.
Yeah, thank you very much.
Thank you.
Much more excited now.
Motion to accept.
I'll move to accept the Frontier Diagnostics presentation as information.
Okay, thank you. Motion on the floor. Any further discussion? If not, I'll call the question. By raise of hands. All in favor? And that's carried. Thanks again. Lunch is here. We might as well, I'll adjourn this meeting, right? There's nothing else further for public presentation?
Doesn't look like it.
No, so I'll adjourn this meeting and we'll break for lunch and